5-Minute Pearls for Clinical Practice. This week's pearl is called Good Cop and Bad Cop. Hello, this is Dr. Brian Morris, and this is 5-Minute Pearls for Clinical Practice, where you will learn the tools to provide exceptional care for your patients. This is the weekly podcast where you will be introduced to time-tested, evidence-based patient care strategies that aren't always taught in schools or training programs, but are nonetheless crucial for success in clinical practice. And each podcast episode is about 5 minutes. We've all seen those buddy cop movies where one cop is the kind and friendly one, while the other is the in-your-face and angry one. The classic good cop, bad cop. Why does this pertain to clinical practice, you might be asking? Well, I've seen many personality types of doctors over the years, but I found that they fall into two broad categories, the good cop and the bad cop. One type of healthcare provider is kind, low pressure, empathic, and understanding. And the other type is a little intimidating, straightforward, right to the point. Someone who's a little more blunt, intimidating, straightforward. Thus, there are good cop providers and what I would call bad cop providers. Not necessarily that one is better than the other, but they take two different personality types and they take two different angles on how to approach patient care. Let's take an example. Let's say a patient's blood pressure is very high and the healthcare provider recommends a hypertension medication, but the patient refuses to take the medication, saying that he wants to lose some weight and work on lifestyle issues first and does not want to take any medication. The healthcare provider can take two approaches. The good cop approach would be explaining in a very kind and compassionate way why the medication is important and trying to understand and validate the patient's feelings with empathy and compassion. Or the healthcare provider could take the bad cop approach and tell the patient that he could die, he could have a massive stroke, he could have progressive heart failure, he could have worsening kidney failure if his hypertension were to continue. So the healthcare provider could use scare tactics, essentially, to get the patient to take the medication. In practice, I tend to see both approaches. In fact, I see some providers practicing both approaches, the good cop and the bad cop approach. And I see other providers who practice the bad cop approach and other providers who focus mostly on the good cop approach. The compassionate approach and the tough love approach is a good way to look at them. Now, you're probably thinking that I'm going to recommend the good cop approach, but the best approach depends on the situation and on the patient. Some patients in some situations require a gentle touch with empathy and patience, and other situations, other patients, other medical problems require a firmer hand, a tough love approach, decisive instructions on what is best for him or her. Most patients in most situations require a combination of these two approaches, sometimes the tough love approach and sometimes the compassionate approach. As you gain experience in clinical practice, you will learn that the art of medicine and the art of healthcare requires both approaches. When to use toughness and when to use gentleness is an art, and it develops over time. The key point to remember is that we need to become skilled in both modes of healthcare. We need to become facile with tough love as well as gentle, compassionate patient care so that we can cater our approach to each specific patient and to each specific situation. No one approach works in every situation. The goal is to put each patient's needs first and design our approach to what is best for that patient and that situation. Remember, good cop and bad cop approaches. They are both important. Let's keep the dialogue going. Let me know what you think of this week's Pearl for Clinical Practice. You can email me at drmorris@5minutemd.com. That's DRMORRIS at 5minutemd.com. You can post your comments and your experiences on the 5-Minute MD Facebook page. You can follow us on Twitter at Brian Morris MD. And you can visit us anytime on our website, 5minutemd.com. Let your friends and your colleagues know about the podcast and make sure that you are subscribed on iTunes. When you are subscribed on iTunes, you will receive new podcast pearls as soon as they are posted. And if you have a few minutes and you enjoy what we're doing here on this podcast, please head over to iTunes and leave us a review. Thank you so much for listening. I will see you at the next 5.